welcome back to my YouTube channel. In case you're new here, my good name is Mercy. In case you're a returning subscriber, thank you so much for appreciating my content and coming back to this channel to watch my content. I really do appreciate. So guys, today, in case you're watching this video and you have not subscribed to this channel, oh my god, please subscribe. I will really appreciate. That is the way that I will know that you guys, you're supporting me. So guys, today I'm back again with another interesting video, another video that if you're a first time mom, you're going to learn something from this video, and I know you're going to utasaidika mahali, you know. Yeah, so guys, today I'm going to talk about how you should nurse your cat or your tear after delivery. That is postpartum recovery if you've given birth through vaginal delivery, or as we call it, a normal delivery. Yeah, in case it was just a cut, what they call an episiotomy, something like that. It's just a surgical incision cut that they cut on your vaginal wall in order to expand your vagina for the baby to come out. Or sometimes you can just have a tear. They don't cut you, but you have a tear when the baby is coming out. Maybe you have a tear as a result of that pushing and the baby coming out. Yeah, so how you should take care of your tear or your cut, it depends on how your delivery was performed. Yeah, so at times some women get infection from that part that was cut or teared during delivery, and it's so painful. It's so painful. I myself did not experience it, but from maybe talking with my friends and maybe listening to people talking and how they are talking about how they got an infection after delivery, and it's something that is so painful, because even when a person is explaining to you, you can see it's painful, and you can just try to fit in their shoes and see how that thing is so painful, because you know, when you give birth, your mind, it's at for you to recover, to go back to your normal being, not feeling pain anywhere. You're just okay. And so at the hospital, when you give birth through normal delivery, maybe the nurse or the doctor or the midwife, or they will tell you that you go home and you sit on warm and salty water. Yeah, that's what they tell you. You go and they say it, endo kalia maji ya chumvi, maji warm ya chumvi, that's how they say it. But in real sense, okay, for me, it was difficult for me, because after giving birth normally, you just have that, like, a trauma, and you don't want to feel pain at that part, because it's so painful. So you're imagining, because you the cut or the tear was what do we call it, ilishonwa. You don't want it to tear it again and you go back to the hospital and experience the same pain again. So you're so cautious on what you're doing. So for me, I was so afraid, and I didn't want to go back to the hospital. Maybe it will tear or something. I was so afraid, so I couldn't see how, or rather I couldn't get the logic of how you're going to sit on the basin that has warm salty water. So for me, what I did, I used to place the basin in front of me, and then I take the warm salty water and splash it. I wouldn't sit on the water and splash it on the part. And yeah, that's what I did, because I imagined, when you're sitting on that water, you have been told you sit on that warm salty water for your wound to heal, but at the same time, this is a wound, it was bleeding, and there are some different fluids that came out of that wound. So when you sit on the water is going to be contaminated with all the fluids and everything, and you're still sitting on the water. Okay, for me, I thought, or rather, I imagined how I was going to get the infection, because of, yani, you're just on that water. I know, guys, you understanding what I'm saying. So for me, I would splash the water outside the basin. I wouldn't take the water that's still a team. Nimekuja, nimekalia, and then I'm still there. I'm waiting for, like, I don't know, 10 minutes or how many minutes for it to get absorbed by the wound. So I would splash the water outside, because obviously you will get an infection from sitting on the water, because that place is supposed to heal. There was some fluid and dirt that came out from that part, and you are sitting on that water. I don't know if you guys are relating with what I'm saying, but what I could advise is, you go, take your basin, take your warm water, your warm salty water, and then splash it on that part, yeah, because there you will avoid getting some infection. And for me, it really helped. It really helped. And yeah, that was my way of healing and nursing my wound. And then after that, after I was comfortable that now that place I can like start feeling it, how it's healing. Because how you feel it, even you yourself, you can check it. Me, I could take a mirror and place it down and then check how the wound is. Yeah, I know. Me, that's what I could do, to see how it's responding, and to know if it's getting an infection, or if the pain that I'm experiencing is an infection. So that's what you do. And then from then, when I was comfortable that now I can now, like, spread my legs a little bit, how I used to treat it, I could take a cotton wool. I take a cotton wool, and then I dip it in that warm salty water, and then I take the cotton wool, and then I pat the area like this. You pat the area like this, and you ensure that the water is being absorbed by the wound. You pat like this, and then from that patting of the cotton wool on the wound, sometimes when now taking out the cotton wool, I could see the threads, the threads that zenye nilishonwa nazo, nilikuwa naona zikitoka, because when the wound is healing, you start seeing those, let me call them threads, because I don't know how they are called. I could see them now. The what do we call it now? The wound is healing, so those threads, that's a sign that's showing you that the wound is healing. So the threads that were the remaining threads that were hanging out, or after the kidonda imeshikana, now those threads starts coming out. So that's how I used to to nurse my wound, and it really helped. They really helped, because I didn't get an infection, and it took a shorter time in healing, because I have a friend of mine who was telling me that even he took around 4 months for the wound to heal, and that's a lot of time, because maybe at maybe 6 weeks there, you're supposed to be now, like, you're going back to normal. It's starting to heal. Yeah, when you're taking your baby for your the first clinic, the 6 weeks clinic, your wound is supposed to be iko karibu kupona sasa kabisa, so mine, I think it took around those 6 weeks, and it was okay. I couldn't feel the pain. I was comfortable even sitting down, because when it's fresh, even you cannot sit down. You're afraid of going to the toilet. You're even afraid of going to poop, because you think that you are constipated, so you're even afraid of going to the toilet. So I was comfortable. So if you're out there and you're nursing your wound, or you're pregnant and you don't know how you're going to take care of your wound, I would advise you do all that I've explained, that is splashing the water outside, not on the basin. And then when it start healing and you're comfortable of feeling how it's healing, now you can take the cotton wool and pat the area. Yeah, so guys, I hope that's going to help someone out there who is hajui ana any clue on what to do. I hope it's going to help you. And yeah, thank you guys for watching this video and for watching my videos. I really appreciate. I don't take it for granted. For the fact that I've come up to now, it's low, but I believe that I'm going somewhere, and it's all because of you guys. So I really do appreciate for watching this video. And if you're watching this video and you have not subscribed to this channel, kindly do subscribe to my channel, because I will really appreciate, and that's the way that I know you're supporting me. So until next time guys, bye bye.